Obesity is not just a matter of appearance. It is a chronic health condition that silently damages the body day after day, while many people remain unaware. When body weight exceeds a healthy limit, vital organs are forced to work harder than normal, from the heart and lungs to the liver and brain. This prolonged overload is the root cause of many serious diseases. Many people believe obesity only causes fatigue or physical discomfort. In reality, obesity is directly linked to the leading causes of death worldwide. In this video, we will explore the most common and dangerous diseases that people with obesity often face, helping you better understand your body and why maintaining a healthy weight is so critical. First is cardiovascular disease. In people with obesity, the heart must work much harder to pump blood throughout the body. Excess fat increases bad cholesterol levels, causing blood vessels to narrow and harden over time. As blood flow becomes restricted, the heart has to contract with greater force, leading to high blood pressure and heart failure. Even more dangerous, plaque buildup in the arteries can rupture, causing sudden heart attacks. In many cases, there are no clear warning signs, and the first heart attack may also be the last. Next is stroke, an extremely dangerous condition closely associated with obesity. Excess body weight significantly increases the risk of high blood pressure and abnormal blood lipid levels. This creates ideal conditions for blood clots to form and block blood vessels in the brain. In just a few seconds, the brain can suffer severe damage due to lack of oxygen. The consequences of a stroke are not limited to death, but may also include paralysis, loss of speech, memory impairment, and a life permanently altered. Another very common disease among people with obesity is type 2 diabetes. When the body accumulates too much fat, especially abdominal fat, cells become resistant to insulin. Insulin can no longer effectively transport glucose from the bloodstream into the cells, causing blood sugar levels to remain high. Over time, the pancreas becomes overworked and can no longer produce enough insulin, leading to diabetes. Diabetes is not just a condition of high blood sugar. It brings severe complications such as blindness, kidney failure, nerve damage, and limb amputation. The majority of type 2 diabetes cases are directly linked to obesity. Fatty liver disease is another silent but serious consequence of long-term excess weight. When fat intake exceeds the body's energy needs, the liver becomes a storage site for excess fat. In the early stages, fatty liver disease often causes no pain or noticeable symptoms, leading many people to ignore it. However, without weight loss and lifestyle changes, it can progress to liver inflammation, cirrhosis, and even liver cancer. Alarmingly, many people who do not drink alcohol still develop cirrhosis due to obesity alone. People with obesity also commonly experience respiratory problems, especially sleep apnea. Excess fat around the neck and chest compresses the airway, causing breathing to stop repeatedly during sleep. Individuals often snore loudly, experience poor sleep quality, and wake up feeling exhausted. Repeated oxygen deprivation during the night not only affects memory and concentration, but also increases the risk of high blood pressure, stroke, and sudden death. Obesity places tremendous stress on the skeletal and joint system. Excess body weight puts continuous pressure on the knees, hips, and spine, accelerating joint degeneration. People with obesity frequently suffer from back pain, knee pain, limited mobility, and a higher risk of injury. Over time, these issues can become chronic, significantly reducing quality of life. Beyond physical health, obesity disrupts hormonal balance and reproductive health. In women, excess weight can cause irregular menstrual cycles, difficulty conceiving, and higher risks during pregnancy. In men, obesity lowers testosterone levels, negatively affecting sexual health and fertility. The risk of cancer is also higher in people with obesity. Research shows that excess body fat increases the likelihood of developing cancers, such as colorectal, liver, pancreatic, breast, and uterine cancer. Excess fat promotes chronic inflammation and hormonal imbalance, creating an environment that supports cancer growth. Finally, obesity has a profound impact on mental health and life expectancy. People who are overweight are more likely to experience low self-esteem, chronic stress, anxiety, and depression. These psychological burdens, combined with underlying health conditions, significantly shorten life expectancy compared to individuals with a healthy weight. Losing just 5 to 10% of body weight can significantly reduce the risk of many serious diseases. Weight loss is not about appearance. It is about protecting your health, your future, and your life. In addition to the conditions already mentioned, obesity has a serious impact on the respiratory system, especially sleep apnea. When excess fat accumulates around the neck, chest, and abdomen, the airway becomes compressed, causing breathing to stop repeatedly during sleep. People with obesity often snore loudly, experience poor sleep quality, and wake up feeling tired and unrefreshed even after a full night's sleep. Repeated oxygen deprivation throughout the night damages the brain, reduces memory and concentration, and significantly increases the risk of high blood pressure, stroke, and even sudden death during sleep. Obesity also places enormous strain on the skeletal and joint system. Excess body weight continuously loads the knees, hips, and spine, accelerating wear and tear and leading to early joint degeneration. People with obesity frequently experience knee pain, back pain, morning stiffness, and difficulty moving. Over time, this pain becomes chronic, limiting mobility, reducing work capacity, and severely affecting overall quality of life. Another serious but often overlooked consequence is hormonal and reproductive disorders. In women, obesity can disrupt menstrual cycles, reduce fertility, and increase the risk of complications during pregnancy. In men, excess body fat lowers testosterone levels, negatively affecting sexual function and sperm quality. These hormonal changes not only impact reproductive health, but also deeply affect mental well-being and self-confidence. The risk of cancer is also higher in people with obesity. Numerous studies show that excess body fat creates chronic inflammation and hormonal imbalance within the body, promoting the growth of cancer cells. Cancers commonly associated with obesity include colorectal, liver, pancreatic, breast, and uterine.
Эмбер Ражди похудела на 200 килограмм, благодаря чему осталась в живых и стала полноценным человеком. Падала с нее. Девушка не могла самостоятельно принять ванну. Чтобы снизить осложнения после операции, нужно было сбросить 10 килограмм, а также согласиться на авиаперелет в их клинику. И это
Research shows that obesity can reduce average life expectancy by several years, and in some cases by more than a decade.
Для нее это был большой стресс предстать в таком жалком виде перед массой людей. Итак, Эмбер прооперировали, и это принесло первый результат. Она похудела на 8 килограмм. После этого диетологи скорректировали рацион ее питания. Преимущественно составляли овощи и фрукты. Она стала употреблять большое количество воды и значительно уменьшила порции, а также серьезно занялась. Огромный прорыв и стимул двигаться дальше. Затем, за последующие полгода, она сбросила еще около 23 килограмм.